So thank you so much, everyone, for joining us. I'm Julianne Tomlin, for those who don't know me, from Center for Care Innovations. This is our Introduction to Adaptive Leadership webinar. We're going to have a chance to review some concepts of adaptive leadership that we're going to work more in depth with on February 12th. So we're really excited to have you join us, and we'll be introducing our faculty in just a moment. But Jody, if you could share with us some WebEx tips for those who are not familiar with WebEx, that would be great.
Certainly. Hi, this is Jody Albert. I'm calling from JSI. I work with the Delta Center. Just to give you a quick few tips on WebEx, all of our participants are muted upon entry, so we won't hear you over the phone. However, you can use the chat box if you have questions, or we'll be doing some questions later that will ask you to type into the chat box. But if you have other questions, for those of you on computer, if you don't see your chat box on your right-hand side of your screen, if you scroll to the bottom of your screen, you'll see a chat box icon, and you can open up that chat. And then I understand if you're on the phone, your chat will be in the upper right-hand corner. You can click on your person icon and see your chat box from there. If you're having any technical issues with not being able to hear or other things, you can chat to me, Jody. I'm the host. And then we just ask, as you're listening in on the webinar, to start thinking about your ideas for your adaptive challenge that you'll be bringing to the in-person convening on February 11th and 12th. Finally, we are recording this webinar, and the recording along with slides will be posted to our Delta Center website at a later time. Thank you, Julianne.
Great. Thank you, Jody, so much. So I want to share with you our objectives for today. And for those of you who are familiar with learner-centered design, we really frame the objectives to be very much focused on what you as learners are walking away with and not what we as presenters are trying to accomplish. So by the end of this session, it is our hope and our plan that you will all understand the rationale for adaptive leadership. Why are we talking about this? Why are we going to be spending more than a half a day on it on February 12th? And get a little more understanding about why organizations must start to look at what they should preserve, what they should discard, and where they might have to innovate in order to thrive. So a little more about that later. You'll be able to differentiate a technical versus an adaptive challenge. And you'll be capable of framing an adaptive challenge based on your journey towards value-based payment and care in preparation of a more in-depth application of these concepts at the February 11th and 12th convening. So if you're not capable and able to do those three things, then we have not done our job here today. So next slide, I'd like to introduce our faculty for today. I'm very excited to have Mark Manishill here with us, and he will be joining us in February as well. I'll share a little bit more about him in a moment. I will say I will be emceeing, and I'll be in the background here, so I will be with you the whole time. But I'm very pleased also to welcome two of your colleagues from North Carolina, Ann Rodriguez and Mary Hooper from I2I Center for Integrative Health. Anne is the assistant director at I2I, and Mary is the executive director, and they are the partner organization to North Carolina's Primary Care Association. And they have been kind enough to join us and work with Mark and me in the last week to really develop an example of an adaptive challenge that they're struggling with, which we will use today to hopefully illustrate the concepts and make it a little clearer and relevant to all of you today. So welcome, Anne and Mary. Very excited to have you.
Thank you. Thank you.
You bet. And a little bit about Mark, who is also with us. You can see we tried to put all of us on video so that you get a chance to see Mark and get to know him a little bit as we gear up to meet in person in the next few weeks. But before I hand over the reins to Mark, I want to just do a little introduction and share a little bit about Mark and why he is joining us here today as our star faculty. So Mark is a consultant and educator specializing in collaboration and adaptive leadership. After spending his early career as a social worker in the healthcare field, Mark went on to pursue an interest in global health and philanthropy, serving as a longtime director of a foundation that organizes global donor circles. He was a program director for a medical relief organization, and he also served as the executive director of an NGO working to prevent child mortality in West Africa. At that point, after all of that, sounds like a lifetime of great experience, he went on to study adaptive leadership while pursuing his MPA at the Harvard Kennedy School from 2009 to 2010. He has since developed and co-facilitated adaptive leadership training programs for nonprofit and philanthropic organizations, including an initiative funded by the B. Robert Williamson Jr. Foundation in New York City. While Mark spends most of his time in Sacramento, he splits his time between Sacramento and New York City, where he's an adjunct lecturer at New York University's Silver School of Social Work, where he works to integrate leadership education into the curriculum of graduate and postgraduate executive courses. He also developed and co-facilitates NYU's Adaptive Leadership Fellowship Program, where a select group of master's level students learn intensively about this framework and apply it in the context of their fieldwork placements. And in addition to all of that, Mark holds a Bachelor of Arts from the University of California, Santa Barbara, and a Master's of Social Welfare from the University of California, Berkeley. So we are in good hands today. And Mark, thank you so much for joining us. I'm going to hand it over to you, and you can share with us a little more about what we're going to do today.
Okay. Thank you so much, Julianne, for that introduction. I really appreciate it. And I'm excited about the work that we're all going to be doing together, especially when we convene together in February. So as Julianne was saying, the main purpose of this webinar is to help us get ready for that in-person session that we're going to do on February 12th, and to introduce the adaptive framework and specifically 3 ideas. First is the imperative of adaptation. Why do we think this framework is important and why we think it's helpful? And then we want to introduce a distinction that we make between authority and leadership. After that, we'll make another key distinction between technical challenges and adaptive challenges. And then from there, we're going to try to lay the groundwork to help your team define an adaptive challenge that you want to work on at the February 12th session and hopefully beyond that. I'd like to start with this idea of the imperative of adaptation. So we use this term adaptive leadership. Why adaptive? Why is that important? And the reason is we feel that there is this imperative to adapt. And I think that it's fair to say that we're living in these times where the change is so rapid, right? And I think this is especially true in healthcare, right? And that if organizations or your associations are not going to be able to adapt to those changing circumstances, there's a risk that you're not going to thrive, you're not going to achieve the impact that you'd like to have, and you may not even survive. And this is true in my experience. So as Julianne was saying, my background is in the nonprofit and philanthropy arena. And I've seen many organizations come and go, a lot of organizations that just didn't make it. And this is true for the corporate sector as well. I'm going to just throw out a question to everyone just to get you active in your using the chat box. If you were to take a guess, if you look at the Fortune 500 companies that were in existence 50 years ago, so the mid to late 1960s, what percentage of them do you think are still in existence today? Anybody care to take a guess there? Just put it in the chat box. I'm not seeing anything yet. Oh, Julianne, you know already. No, you're close. You're close. So I'm saying 30%. I saw 10%. So I wish we had some sort of prize for this. We didn't come up with that beforehand. Okay, 15%. So so between the 10 and the 50s, it's about 13% still around today. Okay, and I don't know what the stats are for the healthcare industry, but I would imagine they're pretty similar, if not even lower than that, right? So when we're thinking about adaptation, we're trying to ask 3 questions. The first question is, what is it that we want to preserve? And a lot of this, by the way, parallels biology. This originates from Darwin and evolution and how we think about species being able to adapt to a changing environment. And we're just trying to apply that, and we believe that that's relevant to the organizational context as well. So the first question is, what do we preserve? And I would argue that there's a lot that we need to preserve, right? I'm not sitting here on this webinar advocating that, violent revolution here. I'm not advocating that we blow up your associations and start from scratch. There's a lot about what you do that works, and it needs to continue long into the future. The vast majority of what you do needs to continue. But having said that, there are also things that need to be discarded, that are not optimally serving your best purposes, that are to some degree holding you back. And that's the hard part, because there's loss involved. There are practices that people have been doing for years, maybe even decades, that are, you might even say, hardwired into who we are. And just, in the spirit of, again, kind of getting this slightly interactive, can't get too interactive with a webinar, but to the extent we can, just try to cross your arms for a minute, just the way that you normally cross them, right? And then just switch it. And just notice what that feels like. And I'm saying to myself, get me back to the way I was. I don't like this at all. That's just just a very simple example, right, of the things that we do every day. Work is such a huge part of our lives. I imagine it's a huge part of the lives of a lot of people who are on this webinar. And we spend so much time at work, and there are things that we do that are part of who we are. So when we're being asked to let go of those things, to discard those things, there is a personal loss, right? Something that we want to be able to keep, but we can't, right? And then on top of that, we then have to learn something. Often we have to replace that with something else. So we have to learn new practices. We have to innovate. So on top of losing something that's near and dear to us that we've been doing day in and day out every single day, we then have to learn something that we may know nothing about or very little about. And that upsets our own I think our own self-confidence and our own sense of competence in ourselves. And so against that backdrop, we think about leadership as accompanying people, or holding people, if you will, through that process of loss, and negotiating these questions of what to preserve, what to discard, and what needs to be learned. How do we want to innovate? But to do that in a very careful way. That's why I write in parentheses here, at a rate that people can absorb. Because if you go too fast, put on too much change too soon, you're at risk of what I would call assassination, in quotations, which I mean figuratively, by the way. You're at risk of being taken out of the game because you have gone beyond people's level of tolerance, asking them to lose too much. So just to give you a very quick example from my own experience, Julianne mentioned that my background, I worked for an organization that works in West Africa around child survival. And it was started by a group of physicians, very dedicated group. They started out at the grassroots level. It had a very do-it-yourself, volunteer-based kind of culture, almost like a scarcity kind of culture. They do a lot with a little. The program work was paramount, and every possible dollar needed to go to save lives. A very noble and important endeavor. And this worked well for many years for the organization. And then this model, which, by the way, has been very effective, it's the model that I've seen that has been the most effective at reducing child mortality in the areas where it works. They started getting a lot of attention from donors and foundations. Lots of requests, lots of demands. And the volunteer culture, the grassroots culture, wasn't able to handle the growing complexity and the time requirements that were necessary. And so the systems just started to fall apart. The organization almost collapsed as a result. They just couldn't handle the growing demands. So they had to face the reality that there was certain change that was going to be needed if it was going to grow and thrive. So if you apply that to the three questions that we were asking before, they wanted to preserve something very important, their programmatic model that had demonstrated results, and how to expand that program model. Very important mission, purpose, and You might even say some of the frugality that they have, you want to preserve that as well, because that's a useful thing to have. But at the same time, they had to discard some of this volunteer-based kind of bootstraps mentality and professionalize the culture. And there needed to be a recognition for better systems, for finance, administration, tracking results, et cetera. But that involved a loss, right? Paying attention to administration and finance are not the, maybe some of you who are providers can relate to this, that it's not our favorite thing to do. We'd rather be out in the field developing programs, spending time with patients. And so they had to overcome that loss and then adopt new practices, new behaviors, professionalizing the culture, hiring finance and administrative staff, creating new administrative systems that would allow them to be able to respond more effectively of the needs of those who were supporting their work. So with that in mind, I wanted to ask you all to think about how this applies to your work. And so I'd really like you to think about this in the context of the transition that you're having to value-based payment and care. So think about the association, your association, and the support that you're providing to your members. What do you think is one thing that is really important to preserve, that is absolutely core to what you're doing? So in other words, something that you're doing really well that you want to continue to do in order to be of service to your members throughout this period of transition. And then at the same time, what is one thing that needs to be discarded? What's something you need to let go of to be able to support your members through this transition? Things that aren't working well and have to change in light of the realities that you face. And then finally, the last one is, what's one thing that you need to do to innovate, to fill that gap of what is being discarded? So what are the new ideas and innovations that you're going to have to pursue to support your members through the transition to value-based payment and care? So I'd like to ask you all to think about those questions. And if you could just type that in the text box, your answers, and I'd love to see what you're thinking about it. So just take a few minutes to think about those questions, about what to preserve, what to discard, what to preserve, and just put that in the text box, and we'll see what people are saying in the chat. Okay, focusing on mission and patients. Innovation, new partnerships that connect us and our members to organizations addressing social determinants of health. So providing a forum for creating a vision and strategies for the future, setting goals, sharing data to hold each other accountable. Discard. I'm only seeing these one at a time, so I don't know if anyone on the team is kind of able to see them sequentially. Are you, Julianne?
Yeah, I see a few that preserving strong training infrastructure and policy advocacy capability. Something to discard, the idea that my association needs to provide everything to our members throughout their transition. And a couple more, value requires time, not quantity. Reimbursement needs to match that. And we heard a discard is all staff wearing all hats, everyone being everything to everybody.
Yeah.
We have a culture of everyone doing everything, which means no one is able to specialize and become truly expert at their area of focus. And a couple more, Mark. Innovation, creating partnerships that make sense in a managed care organization environment. Preserve relationships and discard attitudes about change. So quite a few. Yeah, one more to be discarded. One-time training is a method for improving, supporting our members towards value-based payment.
Oh, okay. That's interesting.
We're gonna
talk about that as an example. Yeah.
Yeah. And
Yeah.
last one, Mark, sorry, something to innovate, identifying our area of expertise and strategically partnering with third parties to fill in our expertise gap.
Great. Yeah, that's a really important one, of recognizing the importance and interest in partnering with others. Okay, well, these are great examples. So it's just to get your thinking going about some of these issues, and we're going to link this in just a minute to some other ideas. And the next one I want to cover here is the distinction that we're making between authority and leadership. This is a key idea within the adaptive framework, and I'm asking people to really kind of keep an open mind to some of these ideas, because in many ways it's challenging conventional wisdom around what leadership actually is. The traditional notion of leadership, I would argue, kind of conflates these two ideas, the idea of authority and leadership, and kind of puts them together and meshes them together. And so in the same breath, we'll say something to the effect of, why aren't our leaders, but what we really mean to say in that sentence is, why aren't people who are in positions of authority exercising any leadership? And so this is an attempt, and we think it's a helpful way to think about distinguishing the role of authority and the functions of authority from the work and the activity of leadership. And so we think about about authority as being more around your role or position or power that you have, which may be granted to you either formally or informally. So you know that there are certain people in your organizations that have the formal title and position, and so they carry that formal authority because they've been put in that position. But there are also people, as you know, who have a lot of informal authority, who may not have the title, they may not have the formal position, but they're people that other constituents in the organization go to because they provide good advice, they're seen as an expert, they're seen as supportive. So that authority that people have can be either formal or informal, but the functions of authority being to provide direction, protection, and order. All really useful and important things. And so I want to make it clear at the outset here that I'm not trying to set up authority bad, leadership good. Not at all. They're just different and have different functions. So we would argue that leadership is an activity. It's something that you do rather than the person that you are or the role that you occupy. And because we think about leadership as an activity, then anyone can exercise leadership, regardless of whether you are in a position of authority or you're not in a position of authority. And so I'd also say that the converse is true. Just because you are in a position of authority doesn't mean that you're exercising leadership. Okay, so maybe some of you can think of those instances where people who are in those positions of authority are not exercising leadership. So we feel that it's helpful to make that distinction. So another set of distinctions that I want to make between authority and leadership is going back to the connections that we were making around the imperative of adaptation. I would argue that authority is more aligned with preserving what works. And in this sense, preserving what works is about maintaining the status quo. And again, I'm not passing any judgment on the status quo. If the status quo is working, what you're doing is working, it's like that old saying, you know, if it ain't broke, don't fix it, right? So you want to preserve what works if what you're doing is working well. But I would say that authority is more useful when you're trying to follow a known path, a path that's based on expertise, it's based on research, right? It's based on authority, right? We know that certain things work. And if those things continue to work, we should continue to do those things. So that's what I mean by following a known path. I'd also say that authority is about a kind of contract for services. It's about setting and meeting expectations of those who authorize you. So the very simple example of this, and I'll probably use a lot of healthcare related examples, is, you know, you're going to say your medical provider or your dentist, for example. You are authorizing that person to provide a particular service for you, right? And as long as that person meets those expectations, you will likely continue to authorize them. So you go into your dentist, for example, You're expecting that that person's going to schedule your appointment promptly, that they're going to return your calls if you have an issue, they're going to treat you appropriately, provide you appropriate care, and treat your cavities or whatever is going on. But if they start failing to do that, they don't return your calls, they're not responsive, you go in, you get your cavity treated, and things are worse when you came out than when you went in, then they're failing to meet your expectations, and you can deauthorize that provider. You can fire them and say, I'm not going to you anymore because you're no longer meeting my expectations. The same is true for all of us in the positions that we occupy. We're given certain trappings often in terms of formal authority. We're given a title, we're given a desk, maybe we're given a cubicle, maybe it's an office, right, depending on your circumstances, right, business cards. If we do a really good job, we might be given a promotion, we might be given a raise, right? But if we fail to meet those expectations and we're not doing a competent job, then we can just as easily be deauthorized by people. And that's the critical point that I want to make here, is that authority is something that can be given to you, either formally or informally, but just as it can be given to you, it can be taken from you. I may be doing things in this webinar. I've been granted a certain level of authority to talk about adaptive leadership, right? But I could do a whole number of things that would be inappropriate, which I won't do, that would cause any of you to deauthorize me, right? And maybe I'm already deauthorized by some of you who are attending this call, right? So that's just a key point that I want to make, is authority is something that can be given to you. It can just be as easily be taken from you. Leadership, I'd say, aligns more with discarding what no longer works. And also, I would argue that it's also about learning, the learning function, when we were talking about the imperative of adaptation. So in this sense, I would argue that leadership is more about challenging the status quo. Not always a good thing if you don't need to do that. If things are working, it's better to use your authority. Let's preserve what's already working. But if something is no longer working for an organization, and you feel that it needs to be changed for the benefit of that organization and the people that it is supposed to serve, then, and there isn't a recognition that this is a problem, then in that sense, it is a kind of challenge of the status quo, of the prevailing norms of the organization. So in a way, you're pushing up against the boundaries of the authority that you have to exercise leadership. And it has to be something that you really care about. There has to be some fundamental purpose that you have that you're willing to go up against on some level against the boundaries of the authority you've been given, either by your organization or even beyond that in terms of the larger system that you're working. I think that's very pertinent to this group and some of the challenges that you're facing, is that you may have to go beyond what is expected of you and do something that may be a little risky. And so I would say that if you don't care enough about it, you've got to have that purpose. If it's something that you feel strongly enough that you're willing to accept the risks of exercising leadership, then do it. But if it's something that you feel, I don't really think that that's important, then I would say don't exercise leadership. Continue doing your job as you have, right? But I would argue is that the leadership requires a purpose, and it requires a certain risk, and I would even say is a little bit dangerous for that reason. Because nobody's asked you to do this. Nobody said go ahead and exercise leadership and affect this change, especially if there is losses at stake for people in that change. So that's why I would argue that leadership is never given. It's something that has to be taken. So I want to just pause for just a moment before I go on to the next thing and see if anyone has a question before I move on. I think we have a minute or two for a question.
Great. And for those who do have questions, feel free to type them in the chat box, and we will read them back to you, Mark.
Is there anything about this distinction that we're making that doesn't make sense, or you don't agree with it? Any thoughts on your mind about this distinction that we're making? Of course, I could just assume that you've all given me complete authority and are agreeing with everything that I'm saying. I can interpret the silence that way.
Rachel's added a really important point, Mark. Sometimes we can't take authority away, like from my Medicaid director.
That may be true, but somebody can take that person's authority away if they feel that that person is not meeting the expectations, the collective expectations that are had of that particular person. So I would say, yes, there are instances where you personally are not going to be able to take that person's authority away. Although I would argue in a certain sense you can, because we often deauthorize people who are in positions of authority. We often blame people. We often complain about people who are in positions of authority. So that in a way is a kind of deauthorization. It's not stripping them of their title or their formal power, but it is a way that people do respond to authority when authority doesn't meet our expectations. So I do agree with that, but it's we often deauthorize people in a lot of different ways, short of robbing them of their position.
Great. We also heard from Bob Sheen in Michigan that we're with you. Strong silence of support.
Okay, Bob, you're making an assumption there, but I'll go with it. All right. Well, with that, and in the interest of time, I'm going to keep going here, just so we can lay out some of these ideas. So the other part that I want to talk a bit about is a distinction that we make between technical and adaptive challenges. And where we're going from here is we're going to then begin to lay the foundation for you defining an adaptive challenge that you want to address in the in-person session and moving forward. So technical challenges, I would argue, and these concepts you'll notice kind of build on each other, and this is why we're trying to introduce them in this way to you today. I would argue that technical challenges go very well with authority, and I say by nature, by connection, they also go well with the function of preserving what works. I call them the tried, tested, and true. We know that based upon our experience, our expertise, research, best practices, that we know that if we apply a particular solution to a particular problem, most likely we're going to get the desired result, right? So the answers to technical challenges are typically found in applying existing knowledge or expertise. And the very simple example, just to kind of go with this healthcare example, is you're going into your physician, you have, say, an infection, a bacterial infection. The physician does a diagnostic based upon his or her expertise, and then gives a diagnostic and then says, you know what, I really think that you need to take these antibiotics based upon my experience. This helps people and you should take them. That person is in a position of authority. They're saying, do this and you will get better. You follow the orders of your physician. You take those antibiotics, you get better, right? As a very simple example. But that example in some ways is misleading in the sense that a lot of technical challenges are not simple. They're not straightforward. They require a lot of expertise and are quite complex. I was recently traveling, so it took that pilot to get me from New York to Sacramento, a very complex series of actions, right, to get me from point A to point B. But the point I'm trying to make is that there is a playbook to be followed. There is some expert. Now, I can't fly a plane. I can't fix most computer problems, right? But there is somebody out there who has gained the expertise who can solve the problem, and we can draw upon that expertise to get to our solutions. It may take a while, it may not, but those kinds of challenges, I would argue, are more technical challenges. The other kind of challenge, to contrast with technical, and we have these overlapping circles because it's not as simple as this. It's not like a challenge that's purely technical, purely adaptive. But I'm kind of oversimplifying just to make that distinction more clear. Adaptive challenges, by contrast, deal with changes in values and attitudes and behaviors. So it's not like the person who's in a position of authority can kind of swoop in and say, I've got the solution to this problem. It's not like IT can kind of jump in and say, I can solve this, right? There is no easy answer. There are no quick fixes from authority, and it's going to require all of us, the best of everyone, trying to make progress on the problem. Not even necessarily solving it, but just trying to make progress on this problem, which we don't know what the answers are. Adaptive challenges often involve conflicts in values between people. This is a hallmark of adaptive challenges. So when I work with different organizations, I often get into these situations, and I don't know if you can all relate to this, where people are having arguments, and it seems like they're having arguments about the same thing over and over again, but it's not. They're using different words, or they're talking about different issues, but it's the same argument, right? When you're in that situation, it's very possible that there's a fundamental value conflict that's playing itself out, where people say, well, I think it should be done this way, I think it should be done that way, but it's the same thing over and over again. Okay, so what is at the root of that perpetual argument, right? What is the elephant in the room that's not being dealt with? That's when we're getting more into the realm of adaptive challenges. Loss is another hallmark. So if the change that you seek is bringing about losses for people, and then there's resistance as a result of the losses that people don't want to sustain, then it's very likely that there is an adaptive challenge at play. And then finally, technical solutions won't solve it. So you've tried technical solutions, but the problem keeps coming back. And so I would argue that whenever you try to put a technical solution on an adaptive challenge, it's probably not going to work, right? So just to give you a few quick examples of that, a number of my students and participants in trainings that I've done over the years have come to me and talked to me about incidents of sexual harassment in the workplace or racism in the workplace. And what are the common reactions of organizations? And you could, if anyone wants to say anything, what are some common reactions of organizations to accusations of racism or sexual harassment in the workplace? I'll see if anything comes through here. But sometimes it's about creating certain policies. Well, we're not going to tolerate that anymore in our organization. So we now have a policy saying that contacting the legal department, exactly, right? It may be dealing with that specific situation, but also maybe in terms of the organizational change, people may say, okay, well, we're going to create a policy saying we're against that, right? And we won't tolerate that, right? We may offer a training, and that is something that often happens in organizations. We're going to offer a diversity training to address that problem. And that's not to say that the training is necessarily a bad thing. It could be a very helpful thing. But oftentimes we see that as kind of like checking off a box, right? I'm offering a diversity training, so therefore we've done something about the fundamental problem of racism in our organization. Okay, box checked, racism solved, right? It's not getting at the root of the problem of why this keeps manifesting. So as much as you may want to do things like change policies or processes or offer a workshop or training, that may not take care of the problem. It may reemerge if there's something in the culture that needs to be dealt with. Another quick example is that I've heard a lot from people in the healthcare arena. We talked about this, Ann and Mary and Julia and I were talking about this issue of electronic medical records, where people kind of come in and say, use their authority, use their persuasion, say, this is going to be great. You're going to have this, you just type everything in. Well, I don't even know how to type, right? So it's going to all be in a central place, and you're going to have it in your room with your patient, and it's just going to be fabulous. You're going to love it. Here's how you do it, right? And we'll give you a training too on how to do that, right? But there's a failure in a way to acknowledge some of the losses involved. Like there are people who have been writing in those charts for decades, right? So how do we involve staff at all levels so they can feel some sense of engagement with a change rather than feeling that it's something that's imposed on them? Or how do we address concerns that arise and hone in on those concerns and kind of find out where people are struggling and to address those things in a responsive kind of way? Or how do we pace the work to provide enough space and time and support for people to make a successful transition to the new way of doing things? So those are examples of more of the adaptive side versus the technical side. And often you need both of those things. So what we want to do now is I want to bring in Ann Rodriguez and Mary Hooper from the Center for Integrative Health in North Carolina. And we want to kind of just work a challenge with you just to exemplify this further and all of this is in service of trying to help you begin to develop your adaptive challenge that you're going to work with your team in more detail in the in-person session. So what we're going to do is, and you'll see the kind of illustration here, is in the left column of this kind of spreadsheet here, we want you just to begin to just articulate the challenge. Just let it go and just write it down. Like what is the larger challenge that you're facing in your organization? And then to kind of break that down into the technical and adaptive, as I was doing before. What are the technical aspects of dealing with that particular challenge? So if you're going to employ a particular technical solution to try and deal with it, what would some of those things be? And then in the right column, what we're going to do is we're going to develop, well, what are some of the adaptive aspects of addressing the issue over the long term that get at changing attitudes, values, and behaviors? And then we'll take you to the next step after that, but we want to work through this example. And so I want to start with you, Ann and Mary, and just to talk about that left column for a bit. So could you talk a little bit, just in general terms, about the larger challenge that you're facing that you want to address?
Well, let me start by saying I am the one that will get in the weeds in a second, and Mary keeps a higher level, and I think that balances out for us, because when I first responded to Julianne and Mark, I gave a very in the weeds thing that was kind of hitting me at the moment. But we had a good discussion amongst the four of us, and we were able to kind of raise that issue up. And what it really is for our providers right now today, they're working in a system that doesn't encourage value-based purchasing and care. And they hear and they see the vision for what's driving it is, in our state, is Medicaid transformation. They see that, and they know that the Secretary is going to put expectations on the MCOs to use value-based contracting. And so they see it there, but they have every day these fires that are cropping up on service definitions and rates and how they're operating today. So to be able to take that focus that you really have to have and commit the resources that it will take to make that shift, and not only that, but the cultural shift and the mindset shift of all of your staff and your board and your leadership to work in more of a value-based environment is, for them, it's overwhelming. They just get frozen by it because they're saying every day we're just trying to provide good services to people. We're doing this in the public system. We're doing this service. And to look to something in the future is just too difficult for them.
So the challenge is literally keeping the doors open, providing services under the current paradigm and making the shift to the new one simultaneously.
That's great. And I think you also kind of set up some really interesting juxtaposition there between some of the technical work of trying to just help people understand these changes and provide information, and some of the adaptive work, which is around the changing of the attitudes, values, and behaviors. So that was a great kind of intro into where we're going. So what would you say, like, could you dig a little bit more into what you think are the technical elements? So kind of listening to what I was saying about differentiating the technical from the adaptive. If you were to talk about the things that you've done or the things that you're planning to do that are more technical in nature to address that problem, could you go through some of those points and elaborate on those for us?
Well, we have really, since receiving the Delta Center grant, we've really ramped up our education pieces on value-based care, and that comes through e-newsletters that we put out where we might have some focus on that. And it also, we have offered trainings. We had a couple really good sessions at our last conference in December on value-based purchasing, and geared not just to providers and to payers, but also to consumers, because in our training, in our big conference, we have all of those stakeholders there, and it's an opportunity. So we definitely did that. But through these education pieces, we are, I don't know if we're being seen as people who have some knowledge about it, which we do have some level of it or some connection to it, but we are both being approached by providers saying, I've even heard from them, so I've heard about this value-based thing. What does it exactly mean for me? And literally sitting on the phone for an hour with a provider talking through the very basics of what a value-based purchasing model can mean. So we have done those kinds of education things. And in addition, we made a commitment kind of at the same time that we were working on the Delta Center grant application. We made a commitment to build a collaborative, and the initial thing that they would do is focus on what are the current issues. Because in North Carolina, we've actually been under a Medicaid waiver and managed care since 2013. It's been statewide. And when we did our provider assessment for the grant, it came down to that of the thousands of contracts that the payers for that portion, the LME-MCOs do, only 3% of them were value-based contracts, and recognized right there that there were some issues. We didn't know what they were. So we pulled together this collaborative, and it's definitely, we were talking a little on the side while you were going over the authority versus the leadership, is that we structured it so that there are very few people on the collaborative. There are only about 8 in addition to us. 3 of them are large providers, and they're across the spectrum on where they are on value-based purchasing and where their commitment to it is. 3 of the LME-MCOs, the payers, and 2 state people that were designated by the Medicaid director. And so by doing that, that was a really good move, and I give credit to the lady next to me, not me, of gaining that approval by the Medicaid director. He came to the first meeting so that he said, I'm in on this, but it allowed him to give over to our organization a job that had to be done, but we can do it with so much more flexibility than he can, and do more of that leadership kind of a role. And so we have the collaborative, and they do conduct regular meetings, they network, and they share information.
Okay. And I think that example of the Medicaid director in some ways is a little bit of adaptive work too, from the way that you were describing it. The things that I'm taking away in terms of the technical aspects is you were doing a lot of information sharing, e-newsletters, conferences, trainings, that you're trying to provide education to people who are interested, right? In value-based care. So those are kind of just to sum up, those are some of the more technical aspects of the work that you are pursuing. And then if you were to go into the adaptive work, and I think you already started to talk about that in a way, but what are some of the other ways in which you feel like you're dealing more with the changing of attitudes, values, and behaviors, the kind of work that's going to take time as opposed to kind of providing the information, but kind of helping people along the path of getting engaged?
Well, I think in a lot of ways, I mean, as you said, and as Ann is indicating, in some ways the technical and the adaptive kind of brush up against each other, because I think in our collaborative meetings, there's, in the context of the technical conversations, there's a whole lot of conversation that's occurring around, you know, what has felt comfortable for some of these providers, what's worked for other providers, how did you get through that part of it, why did you do it that way, what did you do when you got stuck, who did you talk to in your community? I mean, all the parts of the work that feels much squishier and less defined, which I take to be sort of the adaptive conversation, the supportive part of the work that providers who may be not as far down the road in this, in their efforts, can sort of learn from other providers from, and I think that's been very important. I think the other thing that struck me when you were talking was that this business of, authority and leadership. I think within the context of these collaboratives, what I'm observing is that there are a lot of folks who are sort of, I think without even recognizing what they're doing, sort of stepping into that leadership role with other providers, and even modeling some of that, I think, for the state, where the state is stuck in that, the more authoritarian role, but recognizing that others within that context can take on more of the leadership role on behalf of the state. So I think a lot of adaptive things are happening within those collaborative meetings that it almost becomes sort of a lab for that kind of activity, actually.
And the lab, I think, is a great metaphor for it, because it's all about how do you get the best of what everyone can bring to the process, as opposed to saying, and again, I'm not trying to pass judgment on technical. There's a place for technical. I would just kind of differentiate it by, and this is kind of putting a fine point on what you're saying here, is that the technical work tends to be more about the conveying of information, using data and existing expertise, educating people about best practices, known solutions. This is how it's done. Follow this and you'll be good, right?
Right.
Whereas the adaptive work is more about engaging the people in the work of finding new solutions when we don't know what all the answers are, right? And so we need the best of everyone to help figure those things out. What are the ideas that you have to make this work even better? And the hope is that by engaging people over time, that they will have a greater stake in the work, in the change, as opposed to just saying, by nature of my authority, I'm telling you that you need to do this. And again, there's a place for both, but using both technical and adaptive work can often increase the effectiveness of trying to get the job done, as you both have recognized in the things you're doing. So I know that we're running up against time here, so I want to just thank you both so much for the example. And
sure.
We'll be talking to you more in the in-person session about this.
Yeah.
So thank you. So the last thing I want to talk about before we get to the last part of this webinar is just to help you begin to take that information that we have been doing. So putting that information in the different columns, and you're going to get a worksheet to begin working on this with your team. And then to take that and begin to work on an adaptive challenge statement or a framing statement. And I think about this as a kind of statement of purpose, because we could talk at length about the challenge. We could spend a lot of time on it, going into a lot of details. And I think that it's helpful to just kind of break it down, just as we have a mission statement for our organization that really encapsulates the change that we're trying to achieve and what is getting in the way. So we can refer back to that easily. And it's just a work in progress. So this is going to change, but it's just a place to start and say, this is the change that I want to see happen. So that's the first part of the statement. What is it that you care enough about that you're ready to exercise leadership to make happen? And in the broad sense. And then and then against the backdrop of what? What are the barriers or the countervailing forces that are keeping that change that you seek from happening, right? And Mary did a great job of kind of encapsulating what some of those barriers are for them. So just try to encapsulate that in a single sentence. And so I want to give you all just a few pointers as you're going about the process of developing your adaptive challenge statement. The first is, I encourage you to use a single format for consistency's sake, and just to kind of boil it down. The other thing I would suggest is, if you can, try to avoid a technical framing of the challenge. Oftentimes people will put something very specific in that first part of the statement that is actually a solution. So it's a solution masked as a challenge, right? It's something very specific that they want, like a particular tool or solution. But try, if you can, to talk about the change and the desired state that you have in broader terms. Because if this is an adaptive challenge, we have to say that we don't know exactly what all the solutions are going to be, right? So at this point, we just want to say, this is what we want to achieve in the broader sense. And then if you can, try to avoid personalizing the problem. Like if you only were to get rid of this person who's getting in your way, then things would be better, right? but as we say, try to focus on the problem rather than personalizing it, and to focus on the change in the desired state that I was talking about. And then again, the countervailing forces. What is it culturally? What is happening in the organization or even in the broader system or environment that is keeping that change from happening? Because if the change should have happened, in your estimation, then it would have happened. What is keeping it, broadly speaking, from happening? Okay, and that's the second part of the statement. And we kind of came up, after talking with Ann and Mary and Julian and I talked about it a bit, we came up with this kind of working statement, just as an example, based on the challenge that you presented. So how to increase the commitment, right, to value-based care and purchasing against the backdrop of widespread feelings of overwhelm due to the unknowns of change and managing competing fires. So, we could finesse the wording a little bit, but this will give you kind of a general picture of what we're looking for. What is the larger change that you seek? What is your vision of what you're hoping to achieve, not being too specific? And then what is existing in the culture of the system that is keeping that change from happening? So that's all I have for now. We're going to be doing a lot more work around this together, but I'm going to pass it on to Julianne. Are you going to take it from here, or is it Jody?
I will. I'll
Okay.
take it, Mark. Thank you
Great.
so much.
Thank you.
Yeah, so I just want to talk a little bit about what's next. And again, Ann and Mary, thank you so much for helping us illustrate some of these concepts. I think we can stay up here in this theoretical space, and it just it seems to make sense, but until you actually apply it to real examples, it doesn't have that magic. So thank you both so much. And basically, the process that Mary and Ann and Mark and I have been kind of spending some time going through and sharing with you today, you're going to all have a chance to do with your teams in preparation for our February 12th session. So the adaptive leadership session will be on the second day of our time together. In these slides, you see the little icon up at the upper right, and we will also send the link. But this is the adaptive leadership worksheet that you'll be all working with. And you'll work as a team to develop and frame your adaptive challenge. So as Mary and Ann did, they'll start kind of thinking through what is the challenge that they're struggling with, unpacking the technical aspects versus the adaptive aspects, and starting to kind of see the bigger picture, and then moving into that framing of the challenge itself, which is what you'll be working on and going into greater depth with when you join us and when Mark joins us on the 12th. I will say each state can bring one challenge that you're sharing that both associations are kind of struggling with together, or you are welcome to bring one challenge per association. So think about how you want to do that. This is certainly something that you're dealing with either together or individually that is coming up for you in your journey towards value-based payment and care. And that's where that's the only kind of guidance we're giving you on the challenge itself, is it should have to do with that journey. But you can bring one as a state or one per association. So decide as a team how you'd like to proceed. And if you have questions about that, feel free to reach out to me. You have my email at the bottom. But a little information about what's happening on February 12th. We're going to have some really good, solid time together and with Mark. And we're going to continue delving into the example that you've started hearing about from Ann and Mary today, as well as dabbling with some other examples from your colleagues, specifically Bob Sheehan and Joanne Sheldon. We're going to be working with them from Michigan to also have another example that we can pull from so we can really illustrate these concepts. But we're going to spend some time looking at the system that you're all working with and looking at all of the stakeholders that you're working with and understanding, as Mark said, what those adaptive elements, what their values, their loyalties, what they stand to lose, getting a better sense of what's really happening and where some of the emotions are happening. So we'll diagnose the system, and then you'll all get a chance to start taking action and putting together some interventions and some experiments that you're going to run when you get home. And you will each have an opportunity to spend an hour with Mark with some personal coaching, some one-on-one coaching after the fact. You won't be leaving February 12th with all of the solutions in place. You'll be taking something that you're going to test and starting to do this adaptive work at home, and you'll have a chance to consult with Mark on that afterwards. So with that said, the next slide just also has Mark's email, and if you have questions in the meantime that I am not able to answer, I will direct you to Mark. But we really look forward to any questions that you have, and we just really want to hit the ground running when we come together on the 12th. So with that, thank you all very much. Let us know as we move towards the 12th what questions you have, and if we don't hear from you, we look forward to seeing you all on the 12th. And Mark, we'll see you there, and Anne and Mary, thank you again so much, and we'll carry on the conversation. So thank you, everybody, and have a wonderful rest of your day.
Thank you.
Great. Bye.
Bye.